Good afternoon and welcome. My name is Marquita Lilly, and I am the North Carolina Social Action Co-Coordinator for Zeta Phi Beta Sorority Incorporated, and I will be the moderator of the Keep Calm, Let's Talk COVID breakout session. Sora Lindy Brown of Zeta Phi Beta Sorority Incorporated will facilitate the chat. In this session, we will be discussing the impact on mental health and Medicaid as a result of COVID-19. During the course of the session, if you have any questions, feel free to put them in the chat in our Q&A box, and we'll get to as many as we can towards the end of the session. At this time, we will have our panelists introduce themselves, starting with Dr. Natalie Montague, psychologist and business strategist.
Good afternoon, everyone. Thank you, Sora Lilly. I am Dr. Natalie Montague, and I am a member of Zeta Phi Beta Sorority Incorporated. And I am a neuropsychologist. I'm also employed with the state of North Carolina as an organizational industrial psychologist and ER specialist. And I also work for the federal government as a neuropsychologist with the DIA and Homeland Security. I have been a psychologist with the state for approximately about 7 years now. And I also have my own practice, Art of Life Consultations, where I do therapy consultations as well as business consultations. So thank you for having me here this afternoon.
Thank you, Dr. Montague, for being able to join us on this panel. Next, we'll have introductions by Dr. Gregory E. Perkins, a lecturer in the School of Social Work at North Carolina State University.
Thank you so much, and I'm happy to be with you today and be a part of this distinguished panel. Again, I'm Dr. Gregory Perkins, and I've spent over 20 years in mental health practice as a practitioner before transitioning to higher education, where I've been a social work professor at several universities, now at NC State as a lecturer. The primary focus of my prior work as a mental health practitioner was children and families at risk populations, as well as military service members and their dependents, looking particularly at TBI, PTSD, and other traumatic mental health issues. Again, thank you for inviting me, and I'm happy to be a part of this panel.
Thank you very much, Dr. Perkins, for your introduction. Next, we will have the next panelist, which will be Dr. Michelle Laws, Assistant Director at the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services at North Carolina Department of Health and Human Services. Welcome, Dr. Laws.
Thank you. And it is a pleasure to serve on this distinguished panel and participate in the Divine Nines Legislative Day. I am by training a social and behavioral scientist from VCU School of Medicine, and have spent this part of my career looking at researching the effects of social and economic factors on mental health as well as behavioral health, and particularly with an interest in mitigating those effects on cardiovascular and other chronic health conditions and disease. In my position as the Assistant Director for the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services, have really been leaning into the space, looking at the consequences of COVID on behavioral health and substance use disorders. And so I'm glad to be a part of this discussion today. It's very timely and important. Have also served on Secretary Cohen's COVID response team as one of the leads for the Historically Marginalized Populations Work Group.
Thank you very much, Dr. Laws. And our last panelist for this session will be Dr. Danica Clark with Doctors for America. Is she on? Okay, it doesn't look like she's on at the moment. I know she reached out and said that she had an emergency, but she would try to join. But in the interest of time, I would kind of like to kick off an opening question to our panelists. And so, as we've all seen, with COVID-19 is having an unprecedented impact on the world at large, and it has taken a huge toll on patients as well as healthcare staff and systems. But I feel like there's also a window of opportunity there. Is this an opportunity to seize the moment to spark and accelerate changes needed in healthcare? And can we really disrupt the way that healthcare is being organized and distributed and delivered? So my question to the panelists is, how have you seen your roles and responsibilities change due to COVID-19? And what changes do you foresee remaining permanent moving forward? And so if I could just address this first to Dr. Laws, if you wouldn't mind answering that question. Thank you.
Absolutely. Thank you. So one, let me just level set and say that we had parallel crises running in the midst of the COVID pandemic, public health and mental health medical health crises. So we responded to COVID initially at the onset as a public health crisis. Those of us who work in the behavioral health space, and I use that just simply combining mental health and substance use disorders, so I don't have to say that whole mouthful all the time. So behavioral health space, and as well as IDD, but I'll stay on the behavioral health side. Those were parallel crises that were already, running and affecting outcomes for residents in North Carolina once COVID was overlaid on top of it. And so the way our system has responded, that I think in a positive way, is recognizing the flexibilities, that the policy flexibilities that we needed to stand up and implement in order to respond to those parallel crises, the behavioral health and IDD, but behavioral health crises. So telehealth, for example, for so long, people were saying that there needed to be a different way in which people could access mental health and substance use disorders treatment versus, compared to having to go into a physical location to meet with a therapist or a clinician. And so telehealth, for those who have, where broadband is not a barrier, where access to the internet is not a barrier, has been a wonderful way in which our system has transformed itself to be able to make services accessible to persons, to individuals. And so looking at policy flexibilities, looking at what are allowable billable services. So amending our state plan to allow certain services to be provided that in a different way that before the pandemic were not. And so understanding how nimble our system needed to be, and our systems, I will stay in my lane, and that's the mental health and the substance use disorder systems needed to be in order to meet the needs of people. So peer support specialists, recognizing their value as a paraprofessional to support the work that the clinicians and the behavioral health specialists do, making sure that, when we talk about, and on the one hand, when we say social isolation or quarantining, making sure that we are mindful of populations that we serve where social isolation exacerbates their lived experience, mental health and substance use. So I think this pandemic has created a wonderful opportunity for us to make our systems more nimble versus rigid, which is the way in which they have been. There's a lot of work to do, but we need to be able to provide services, mental health and substance use, especially as we look at the ongoing trauma that African American communities are experiencing in the social justice space. We need to make sure that we can deliver services in a timely manner, in the right time, in the right places, and hitting the populations that need them the most, and also making sure that we have culturally and linguistically appropriate services. And so that forced us to take a look at who our providers are. So I think it has created tremendous opportunities for us to build a better system.
Thank you so much, Dr. Laws, for all your feedback regarding mental health and substance use. So now I'd like to move on to Dr. Natalie Montague. The same question. What type of changes have you seen, positive or negative, within your current roles and responsibilities?
Okay. Some of the things that I have seen that has come down the pipeline, especially working with North Carolina state government, I'm often on the HR and employee relations side of things. I was being an industrial psychologist and behavior analyst. Policies and procedures, for one, has definitely changed with giving employees more time off than what they normally would have because of this pandemic. We had to go back and look at the procedures that we had in place with Office of State Human Resources, for one, and see how those policies and procedures correlated with federal standards. So once we took a look at what the state has, and on the federal side, that's when we all had to come together and say we need to make changes. We need to be able to give employees the appropriate time off to recover from COVID, as well as their children. We also had to take in consideration that now you have your children that are at home doing things virtually. They're now getting educated virtually. So that was another thing we had to take in consideration, not just employees themselves, but can we give the employees enough time to effectively do their jobs in a virtual environment, as well as cater to their children while their children are going through their education virtually. So those are some of the things that have changed. For me, as far as my roles and responsibilities, I frequently would go out to some of the hospitals. North Carolina DHHS is one of my bigger agencies that I have. So I'm frequently going out to the different agencies across the state. So for me, that had to be cut back because of the pandemic. So I was not able to provide services as quickly as I normally would with some of my staff, and as well as some of my my physicians and my nurses. So it has to come to, having more telecommunication. So that definitely has changed. And some other things that I have noticed that for us, the employee morale actually has picked up, because people are saying, now I'm able to do what I really need to do, being in a home environment. And we have seen a productivity in work. We also have seen an influx of mental capacity when people are being productive. More people saying they're more productive now at home than they are actually into the office. So that's one study that I'm currently working with the Office of State Controller at this moment, is to do a correlation of the impact of seeing what employees are doing now versus what employees were doing pre-pandemic, and the mental capacity that they have to perform the job. Has it declined? Has it increased? Is it about the same? And are they still able to provide the same amount of services and as quickly as they could prior to the pandemic?
Thank you so much for your response, Dr. Montague. That was very informative. Now I have the same question for Dr. Perkins. In your experience as a mental health professional and now currently a lecturer, what changes have you experienced within your field during the course of this COVID-19 pandemic?
Thank you for allowing me to respond, and to my colleagues who've previously responded. I want to say thank you so much, because you're right on target to what we're experiencing, because I still do some private practice work here in my local community and some consultation. And so what you're saying is very much true. What we've seen here on the provider side is that the state has made some adjustments to allow flexibility in how services are delivered. I have one agency that I consult with that has outpatient practitioners who are now doing telehealth and telemedicine. We also use psychiatrists, Villa Telepsych, which has been a tremendous asset to the local communities to ensure the continuity of care and services for those in need of behavioral health services. Another agency that I consult with is a 24/7, 365 responding agency. They take care of the needs of the most chronic mentally ill, as well as provide residential treatment services. And as you know, those things did not stop during the pandemic. But when you start talking about isolation and how that affects one's behavioral health in a broader sense, it is definitely something that we need to take a good look at, because this isolation and keeping them, in close proximity to each other, not having the opportunity for outings that we normally use to help people, with their coping skills, has definitely had a tremendous impact. But I think if I could just sum all up what everyone has said, I think what we've experienced here in North Carolina is a very thorough, systematic, and scientific informed approach to how we deal with the pandemic. And I think that our state government and leadership has been very systematic in how they allow agencies, particularly as those that I've worked with, including higher education, how they respond. They've given a lot of latitude and a lot of support and in resources as well in helping meet the needs of the citizens of North Carolina, and particularly those who have experienced behavioral health concerns. And so, yes, leniency in how we're able to build and how they're able to receive their reimbursement payments, flexibility in how we access them, either by telephone, telepsych, telehealth, virtual. A lot of that is still going on. I think those are key indicators of a government and a state that's working in collaboration with each other, with providers, with healthcare providers, with the mental health, behavioral health providers, with educators. All of our higher ed institutions have went through some changes. I know at NC State we've had some dramatic changes, but we're beginning to see those level off now. And so the students feel more comfortable about coming to class. We just finished our spring semester, and while students had the option of face-to-face or in-person, we did see a significant number who had to be referred for healthcare issues, whether it was physical health or mental health. But we had the capacity and ability to do that because of the flexibility of state government and providing us with resources and opportunities to affect change in a positive sense to meet the needs of our citizens. Thank you.
Thank you so much for your response, Dr. Perkins. So now I kind of want to transition the conversation a little bit. And so with the physical stress of infection is now decreasing with the implementation of the COVID vaccine, but COVID-19 patients tend to carry emotional scars from the pandemic experience for months and years, often in the form of a post-traumatic stress disorder. So I want to direct this next question to Dr. Natalie Montague. So what exactly would be a post-COVID stress disorder? Could you enlighten us to what some of the qualifying factors would be, and how does it compare to PTSD?
Thank you for that question. When we are looking at PTSD as a whole, similarities with COVID actually mimics what's already in existence with some additional factors, and those additional factors could be isolation and also having someone to pass away from COVID, which could still once again be part of PTSD. And COVID-19 has already led to diverse mental health problems, including anxiety, your depression, other trauma and stress related disorders. However, within COVID-19, at this moment, research is still being done. It does not really fit into the prevailing post-traumatic stress disorder model just yet, or diagnostic criteria. But there's emerging resources that's coming about, and traumatic stress disorder research that's being currently done because of the global stressor. And so some of the factors, I have worked with some patients of mine, they have told me, they are very fearful now of going outside without a mask. And that is something that National Institute of Health is also reviewing, trying to get that indexed and classified under one of your mediators for PTSD, that fearfulness of going outside, that phobia. So should they now include that phobia part of COVID-19 into part of PTSD? So it's still going through some extensive research at this moment. It may not be anytime soon that we actually can pinpoint and say this, and this is a component of PTSD per COVID-19. So they definitely, what people are going through with COVID-19 is mimicking what PTSD, and you have different variances of PTSD. Some people have PTSD due to maybe if they were injured in military or if they were a victim of some type of abuse. So it's still being reviewed at this moment. And hopefully some of the components for COVID-19 can be classified under PTSD. But once again, it's very tricky and studies are being done at this moment.
Thank you for that clarification, Dr. Montague. That was very helpful because I know that there have been quite a few questions with people feeling all of this pressure and stress and anxiety and how that related to PTSD. So thank you for that clarification. And I know that we've been talking a little bit about isolation. So this next question is actually directed towards Dr. Perkins. So with the coronavirus, the pandemic, it can take an emotional as well as physical toll. And that includes children having to undergo virtual learning, being isolated from their peers, non-essential workers are either out of work or now they're working remotely. So can you talk a little bit about the impact of isolation on the mental health of adults and children as a result of this pandemic? And what are some coping mechanisms or some tips that you would have for the audience if anyone is experiencing any of these type of issues with isolation?
Thank you so much for the opportunity to discuss this particular matter because it is one that has been of great interest and concern to me as I work with the different organizations across our community. So yes, children away from school, who are away from their friends, and one of the things we have to remember about children is 80% of their socialization takes a form in school environment. Because when you talk about K through 12, that is, where they spend, 80% of their days. And so 80% of their socialization takes away. So when you take that away and you say you got to stay at home with mom or dad, aunt, uncle, grandma, papa, Nina, Nana, whomever those people and individuals may be, it takes on a whole new context. And so when you're talking about doing it for a day or two, that may be okay, but we're a year and a half into this now, and some school systems have not returned to in-person learning, and some have made it optional, and some families have just decided that they're just going to stick with the virtual learning. The impact on the socialization of our children, adolescent through young adulthood, those 18, 19-year-olds, it's profound. And so one of the things I think that we need to start looking at, particularly for those, is to look at ways in which we can provide opportunities and take advantage of opportunities to engage, whether it's on a community level, neighborhood to neighborhood. I know in my neighborhood, we have several little entities or pockets of individuals who are comfortable with themselves. My son lives in Durham, and they have found this little pocket in their neighborhood where they're comfortable with a group of neighbors. And so they allow their children that space so that they can go outside, they can be a part of the air. That's another part. The air outside is very, very helpful for our minds, and I think my other colleagues will agree with me when we start talking about from a health standpoint how important it is to have that air, to breathe that air rather than being inside all the time, notwithstanding that some are definitely fearful. But when we talk about adults, we too have been impacted by this because we have a different set of professionals and individuals with whom we socialize with, whether it's on a professional level or whether it's, just, one of those things we do on the weekends or the third Friday of the fifth Sunday of every month or whatever, our item might be. even, take, for example, this Divine Nine, all of my brothers and sisters, I shout out to all of you out there in Greek land. But just think, we've not had our conferences, our conclaves, or whatever we call those events that we have. And those for us are our opportunities to get together and to share with our sorors, our frat brothers. And that is part of, the dynamic of us taking care of ourselves, socially, mentally, and professionally. We've not had those opportunities. The other thing I think that a lot of us may have considered, but we're really not paid a lot of attention to, is what about our healthcare professionals? What about our frontline workers who have been in this from day one? We have lost a number of them. A number of them have lost their lives to COVID, and a number of them still struggle with what they call the COVID long haulers, those who've been affected by the pandemic. And so I think we need to make a concerted effort as professionals to look out for ourselves and our own health and our own well-being. And so some of the ways in which we can do that is we can dare to be different. Dare, Dr. Montague, to be different from those who are afraid to go out and make contact. Then we're going to have to be some trailblazers. We're going to have to mask up and go out there. And if you need some gloves, put some gloves on, whatever you need, because we need that socialization as adults, as professionals. We need that just as much as our children need that. And so I think key for all of us, for those of us with children, for those of us who are professionals, in our own settings, we need to find that space that we're comfortable with so that we can begin once more and again to interchange, interact with individuals, whether it's, like I said, in our little neighborhoods, in our pockets that we're comfortable with, or a grander scheme of things. I live in Fayetteville, and so we've done a lot of things here in our community to engage people and provide opportunities for them. Look, go to the mall, put on your mask, go to the mall, walk around, walk through the food court, whatever. But we need to get out. We need to reacquaint ourselves with the beauty of nature. It's summer, it's spring, of what all of that has to offer us, because it not only affects our mental and behavioral health, but it also affects our physical health. Get out, go for a walk in the park. If you don't have a dog, think like you have a dog and just go and get out. We need to get out. And so if I could say anything to any of us, get out. That would be it. Let's get out. Thank you.
Thank you, Dr. Perkins, for your response.
Marquita, before we go to the next question, I want to tie some threads together, because what the
Absolutely.
two doctors have said is everything is extremely important. And as a social and behavioral scientist, I sort of want to step back and just sort of stress why what they're saying is so important and why this discussion is so important. So if I may, I did prepare, I put on my
Absolutely.
old professor hat from, I taught at North Carolina Central and North Carolina State. So may I just a few
Yes,
minutes?
this is a free flowing forum, so whatever you want to do, the floor is yours.
Thank you. So let me share my screen here, and let me start here. I want to, so it's important for us to understand, especially when we're talking about African Americans, that there's nothing genetically that's predisposing us to experiencing a disproportionate burden of psychosocial effects, psychological effects, emotional effects of this pandemic. We unfortunately were in the we were in the path of the storm. When we think about, and I just want to again tie some pieces together. When we think about trauma and the fact that we have lost so many family members, community members in the face of this pandemic due to this COVID-19 virus. African Americans from the onset had double, almost triple the death rates compared to whites. 2.8 times more likely to die from the COVID pandemic. African Americans were more likely to be exposed as frontline workers. And so I'm so glad that Dr. Perkins talked about taking care of those on the front line, Because when we look at who had the luxury, the privilege of working from home and thereby reducing their exposure, especially at the onset and at the peak of the apex of this particular pandemic, African Americans, about 19.7% of them said that they could work from home or telework. And this is compared to 29.9% white and 37.0% Asian. So we, along with our Hispanic and Latino or Latinx brothers and sisters, were more likely out there having to go to work long before the vaccine. And as we were ramping up testing, getting out PPE and so forth. When we look at the impact on children, yes, all kids, all families had to educate their children at home. Parents had to become school teachers in addition to doing their work. But when we look at the impact on African American kids and kids of color, we see that our kids are lagging behind or were lagging behind due to this what's called lost learning experience as a reason, are multifactorial reasons for that. Not adequate internet access. Some parents not being able to. Some parents not having gone far in school themselves. And so when they have to co-teach their children and have to follow, having to work multiple jobs, not working in jobs where they could take time off, where they got, at the state, we get our regular, annual leave, we get sick leave, we get community service hours leave, we get, family. So not all of the workers were that fortunate. And when you disaggregate the sectors, you will find high representation of African Americans and Latinx parents who had to work in jobs that just were not flexible enough or afforded them the opportunity. And as a result, parents are seeing, they know what the data are showing. When we look at the average learning lost, our kids, Black kids, have lost about 10 months compared to about 6 months of schooling or education during this pandemic. And of course, this varies. We know that more than back in December, a study findings were released that more than 10,000 North Carolina students were unaccounted for, and the majority of those were students of color. And when they say unaccounted for, they hadn't logged in to school. And so that's a stressor. When you think about Blacks and Hispanics and young people and low-wage workers, they were being hit hardest by the eviction crisis. Even though there was an eviction moratorium, there were some very clever housing, homeowners and renters, real estate agents and so forth, landlords that figured out a way to get people out of their properties. And so when we look at who was hardest hit in the housing crisis, African Americans. We can look at this data when we think about foreclosures, African Americans, about 9% African Americans and 11% Hispanics reported during the peak of this pandemic that they had experienced evictions or foreclosure. Some were 16% African Americans reported loss of wages that directly affected their ability to pay their rent and were delinquent in their rent by at least 3, a stressor. When we look at the unemployment rates in North Carolina, Black workers in North Carolina are 30% more likely to be unemployed than their white counterparts. A stressor, 9.1% of Black unemployment in North Carolina compared to 7.4%, a stressor. And so when we think about the stressors in general, in the general population, think about how it's magnified when we talk about African Americans in particular. This study was published, 40% of adults reported experiencing anxiety and depression, substance use increase, suicidal ideation, and traumatic stressor-related disorder symptoms. And so when we think about the connection to COVID, it's a bidirectional. Not only does increased stress and anxiety and depression increase our risk of or are exacerbated by COVID. So they're increased by COVID, by the COVID pandemic, like Dr. Montague spoke about, and people who haven't gone out, people who are socially isolated, workers who are trying to figure out how to work in this environment, who are fearful to go outside and so forth. So that's one direction. But also we know that it compromises our immune system, and it also has a psychological effect that also increases the risk for COVID infection. And I'll be done. Look, so when one study, Wang Zhu and Volkov discovered in their research that among patients with a recent diagnosis of a mental disorder, African Americans had higher odds of COVID-19 infection than Caucasian, with the strongest ethnic disparity for depression. So that means Black folk with depression are also more likely to get COVID due to multiple factors, including a compromised immune system, not getting rest, staying up all night worrying. And so when we think about the share of adults reporting anxiety and depressive disorders linked to some of those social factors that I mentioned, there's a direct correlation. And so this conversation is important for a whole host of reasons. There's a whole list of slides, but I mean a whole set of slides that I could go through, but I definitely wanted to share that and add to that, and I will be done, add to that the ongoing trauma and traumatic experiences that we are experiencing in our communities. And so not only do we have to deal with COVID, and not only do we have to deal with burying our loved ones in non-traditional ways that don't validate and don't honor our rituals, going and having homegoing celebrations, getting together for repasses, having families over to the house. We couldn't do any of that, right? We weren't supposed to do any of that. But not only are we dealing with that, but we're on top of that, we're continuing to experiencing police killings, like what's going on in Elizabeth City. And I bring Andrew Brown into the discussion because he had a family. Now this is a younger picture, his kids are older, but he had children who now have to learn in a non-traditional learning environment due to the COVID pandemic, who more likely than their counterparts, their white counterparts, have fallen behind in school, and the family has to deal with the stressors of that, and as well as the children. But now they got to deal with the fact that their dad has been killed, and we don't know all of what happened. And the more we learn, the more disturbing and troubling it is. Ahmaud Arbery and Breonna and George Floyd, there are many. And when we think about wealth inequality and how that's affecting us, then it's no surprise that we need to have this conversation. We need to have targeted responses that invest more in community-based solutions to behavioral health, the behavioral health consequences of this pandemic that are trauma informed, because we all as a community have been traumatized in one way or another and are dealing with the psychological and emotional effects of it. Thank you for allowing me to just tie those pieces all together.
Well, thank you, Dr. Laws. I really appreciate that. As I mentioned, this is a free-flowing forum. So I'm glad that you were able to connect those pieces together for us. And thank you for sharing your slides and speaking so passionately about this issue, because it's definitely important to our community. And we want to make sure that people are informed and they know what's going on and they are aware of the numbers and the statistics. So I thank you so much for sharing that information with us. And Dr. Perkins, did you want to add something as well?
Yes, and so thank you, Dr. Laws, for that, because what you reminded me of is Dr. Montague was mentioning earlier about the research that's going on to tie some of those symptomatic factors or symptomology with PTSD. I'm reminded that when we talk about post-traumatic stress syndrome, there's a precipitating event. And Dr. Laws, you presented to us very eloquently a long list of precipitating events. And what happens, just for our audience to give them a better understanding when we say PTSD, what we're actually talking about, that precipitating event is life-threatening. You believe it's going to happen to you, it's happened to someone close to you, but you believe that it's going to be a life changer, where there's going to be loss of life, limb, property, whatever. It's going to be devastating. And so it's because of those events that you feel as though because of these precipitating events, you're reliving that experience. And so when we talk about a George Floyd event, you're talking about reliving, the horrific event, of him having the knee on his neck for X number of seconds, right? When you talk about COVID, you're talking about, as Dr. Montague talked about, people being fearful of going out. You're fearful of your life. You're fearful that if you go out into public, whether you touch something, someone breathes on you, someone coughs on you, you're fearful that you're going to lose your life. So as a practitioner, I'm telling you, it's very, very pragmatic that we will find people who will come to us with post-traumatic syndrome-like symptomology that we could easily identify and codify under the DSM-5 as being post-traumatic syndrome because it is a precipitating event. They're reliving that unpleasant experience. They're coming with all the signs and symptoms, Dr. Montague, that you mentioned, that they're being stressful. You've already gave us, Dr. Laws, a whole list of events that could lead us to that. And so I think as practitioners, what we need to do is we need to help people get the help they need by any means necessary because, codifying this diagnostic criteria is what meant for black people anyway, because we've always had, as one man said one time, I got sugar, okay, what is that? But we understand what he's talking about, but we need to be able to codify that with an F code so that individual can get the service they need. So when they come to us with shortness of breath, heart palpitations, and anxiety through the yin yang, we understand that untreated anxiety, when left untreated, it also leads to exaggerated levels of depression because if we don't treat that anxiety, they become extremely depressed. And so that's the other spectrum. Y'all see my hands here? That's the teacher in me coming out. Yeah, that's the whole full spectrum. Anxiety at one top, depression at the other. And when these two collide in the middle, that precipitating event stresses them out to so much to the extent that they cannot perform the activities of daily living. And now what we have is full-blown PTSD. I think, just from a pragmatic perspective, that in the final analysis, we will find that the COVID-19 epidemic in the African American community is a PTSD stressor. And I think that we can codify it and get our people the help and assistance that they need through this bureaucratic system of behavioral health and health care that we have, not only in North Carolina, but in the state in general. And that's just my passion. Thank you.
I would like to also kind of piggyback off of what Dr. Perkins stated, as well as Dr. Laws. Our Black and Brown communities is already going through some despairingly things as it is. But when it comes to the mental health aspect of it all, when I say we, Black and Brown communities, we are still very leery about reaching out to receive any type of assistance dealing with mental health because it has a stigma, if you will. And it can also go back, and not to get too far off track, but it can go back from a long time ago, grandma and great grandma. What goes on in this house stays in this house. Okay. And that mantra and that mentality has been passed down from generation to generation. So now we have a race and a group of people that is not dealing with oppression, injustices, but on top of that, you're now adding on mental health. And that mental health may already been there from the beginning. But now we have this pandemic, this global pandemic that is on top of everything else that people are feeling. So we have to find a way to get Black and Brown communities to be willing to participate in mental health endeavors and initiatives and be able to show them that there's nothing to be ashamed of. There's not anything to be ashamed of if you have some type of mental health. I don't like using the word disability at all, but if you're going through a mental health crisis, it's okay to reach out to somebody. And I may step on some toes what I'm about to say next, but it is what it is. I often have patients to come into my office and they have had an ongoing issue for quite some time, okay? they have gone to someone in the church, whether it has been a deacon or that preacher, that is not certified in mental health at all. And they have been given some type of information that is not beneficial to that individual based upon the symptoms that they are exhibiting. And they have used that information from this uncertified individual for 4 or 5 years, but their condition, it has now worsened. And I encourage everyone, if that individual is not licensed, is not certified to deal with any type of mental health related issues, please seek assistance and guidance from someone that is. There's quite a few free resources out there available. You can be anonymous. They are more than welcome to refer you to a nonprofit agency. You have other practices such as myself. We do non-sliding scales. Your insurance, a lot of your insurances, especially if you are a state employee of North Carolina state government or in the university system and you have state health insurance, a state health plan, that is covered. Mental health, and a lot of people don't know this, and that's something I encourage everyone. See if your primary care insurance for your medical covers mental assessments and mental health. Once again, if you're a state employee in North Carolina, you have a state health plan, that is covered under your health plan. It could be anonymous. Some people feel that their agencies, we offer EAP in state government, your employee assistance programs. You don't have to go through that. You can go on your own. So that's one thing that we really need to find a way to encourage our Black and Brown communities, not to be fearful for receiving and reaching out for mental health conditions they are having or anyone in their family. Thank you.
That is so, I want to just, that is, clap hands, snap fingers. That is such an important message to deliver. And I have had a recent case. I dropped the Hope for NC helpline number in because that's one of the flexibilities. That's one of the things we know we needed to stand up quickly, was one number that people could call and get connected to resources in their area, no matter where they are in the state. But I had, so under my team at DMH, are the consumer support services and consumer rights, customer support, customer service, community stakeholder engagement, and empowerment team in our state CFAX. And we had a call come in, and the person actually was referred and insisted on talking to Dr. Laws. And so I get the call, which was actually routed or sent to us by a colleague in another division. It's a pastor. It was an assistant pastor and at a particular church somewhere in North Carolina. And the pastor was dealing with a substance use challenge that with COVID, with the loss of resources to his church, not being able to pastor, he began to slip in recovery, to go back into active use, substance use. He didn't want his name on anything because of the visibility and the profile that he has in his particular area. And I at that point put on my ministerial hat and sort of said, first of all, understand this has nothing to do with your calling. This has nothing to do with your ability to pastor. This is a health issue. And we need to, just as we would look at it like hypertension, your hypertension is out of control, we need to deal with it in this aspect. And so I think Dr. Montague is absolutely spot on, and that was so important. Not only do we need to get rid of the stigma that acts as a barrier for people accessing help, but we also need to make sure that our faith leaders are equipped with trained professional behavioral health specialists and therapists and psychologists and professionals that know how to respond. You can't pray it away. So stop telling folk just pray it away. You can't, they don't need to be delivered from a demon. Although there may be some demons that they might be, but mental health is not one of them, and substance use disorders are not either. And so I think that is so important. I see it in live time on a day-to-day basis where people want to reach out in our community, but they're afraid. They're afraid of being found out, and that's the stigma, or they just don't know how to help. And so that's important. And then our elders, and I will be done, I'm sorry. Our elders, think about it. Their main social network was church. When the church doors closed, they couldn't go out and meet sister so and get ready for church and go to, whatever. And so we also have to think about mental health care for our seniors in a unique way, because they've dealt with this pandemic also in a very different way.
Thank you so much for your follow-up on all the responses, Dr. Laws. At this time, our fourth panelist just was able to join us, Dr. Danica Clark with Doctors for America. So I want to give her a moment to briefly introduce herself. And then Dr. Clark, after you introduce yourself, I know that you're just kind of joining the end part of this conversation, but if you would be able to maybe provide some resources that you know of that would be helpful to our audience who are facing mental health issues, anxiety, depression. What are some things that we can do from a community standpoint to reduce the stigma, to allow people to seek the help that they need? So I'll hand it over to you at this point, Dr. Clark. Thank you for joining us.
Good afternoon, everyone. Please accept my apologies. I had an emergency hearing this morning with a family, but my name is Shanta Danica Clark, and I'm very excited to say hello to all our divine brothers and sisters. I actually am this, I guess you can just say how I explain myself as an advocate, but on a daily basis, I'm the director for 2 different states, North and South Carolina, for Doctors for America. And we are actually a very interesting organization. We were founded by the Surgeon General that we have now. His name is Dr. Vivek Murthy, and it is the largest physician med school nursing program, advocacy program in the country. What we do is try to promote healthcare through each and every person that we come across, but definitely through through the assistance of individuals who are in great higher ed programs, and these programs are in some people that are in MPH programs and people that are in MD programs, as well as individuals that are in nursing programs. And so we want for individuals to have advocacy training to meet the needs of our populations. And as we know, Brown and Black marginalized communities are enormously affected by this pandemic. And we've partnered with Biden's Community Corps. And the Community Corps is related to faith-based organizations and community-based organizations to ensure that our people that look like you and I are able to eliminate some of the stigmas related to access to healthcare, particularly when it deals with access to vaccines. Some of the 3 T's I always say are the things that hinder us. And those things are time, technology, and transportation. And so many people have access to technology, whether it's handheld devices or laptops or desktops, but a lot of times our people in our communities they may have them, but don't know how to access them properly. And even something as small as knowing that if you're going to enroll or register for a vaccine, what that means. Like, what does it truly mean? will you be able to access your email? Will you be able to, do you feel comfortable answering your phone if the number is a number that you don't recognize? So therefore, that's why we've instituted the assistance of faith-based organizations, as well as physicians that look like you and I, because we know our communities. We believe in our good doctor that looks like us, and we believe in a good preacher that looks like us too. So therefore, we have to ensure that we are able to encourage our faith-based organizations to let these leaders know that you are the catalyst to help our communities feel healthier. And we all have to do PSAs, and that PSA starts with, I care for you as your physician, I care for you as your faith-based leader, and I care for our community. So you need to join with me and become vaccinated. Because of the, I'm sorry.
Oh, I'm sorry, Dr. Clark. Not to cut you off. And I know that you have such a wealth of information to share with everyone that's on the call this afternoon. But at this point, we're going to get ready to transition for our next session. So if you have any quick closing remarks that you can do in the next maybe 30 seconds, and we'll get ready to go ahead and close it out.
I'll place everything in the chat.
Okay, thank you so much for being able to join us. Dr. Clark, I know that you did inform us that you had an emergency, and I thank you for pressing your way to join us this afternoon. With that, I want to thank all of our panelists who were a part of this Keep Calm, Let's Talk COVID breakout session. Thank you, Dr. Gregory Perkins, Dr. Natalie Montague, and Dr. Michelle Laws. Thank you for joining us this afternoon. I greatly appreciate it. You have communicated a wealth of information to our audience, and I thank you for answering my call when I reached out to you, and it's just been greatly appreciated, and I really enjoyed the conversation this afternoon. So thank you very much for joining us, and we'll get ready to transition to our next breakout session. Thank you.